Great, for all the attendees, welcome to the first virtual grand rounds of 2019. My name is Shannon Strader. I'm a third-year medical student at Lincoln Memorial University in Tennessee. I am this year's AADMD Virtual Grand Rounds facilitator. For those that are new, Virtual Grand Rounds are a webinar-based presentation model that create a space for mentorship and exchange of knowledge experience between seasoned IDD providers, entry-level clinicians, and future healthcare providers in training. The purpose of the Grand Round sessions is to expand and strengthen the IDD healthcare workforce across a spectrum of experience levels. After this meeting, we will be sending out a SurveyMonkey for feedback on how to improve these meetings. I would like to introduce our presenters and a small bio. Dr. Stephen Sulkes attended Boston University for college and medical school. He completed a pediatric residency in Syracuse, New York, and fellowship in developmental pediatrics at Boston Children's Hospital before settling in Rochester, New York, where he has spent the rest of his career at the University of Rochester. Dr. Sulkes has provided primary care for individuals with intellectual and developmental disabilities in residential and community settings, and developmental behavioral pediatric specialty care at Children's Hospital in Rochester. In 1985, he developed Rochester's fellowship program in developmental behavioral pediatrics, initially funded by New York State, then by the Maternal and Children's Health Bureau Leadership Education, Neurodevelopmental, and Related Disabilities program. He then took on leadership of Strong Center for Developmental Disabilities, the Rochester University Center for Excellence in Developmental Disabilities, which he now co-directs. He has served on the board of Association for University Centers on Disability and the American Academy of Developmental Medicine and Dentistry, whereas he is currently the president. His research and advocacy passions merge around improving healthcare delivery for people with intellectual and developmental disabilities. Our next presenter is Caitlin Richardson. She is currently the Director of Employment Programs at the Strong Center for Developmental Disabilities at the University of Rochester Medical Center. She also supports policy efforts at SCDD and is a third-year doctoral student at the University of Rochester's Warner School of Education. Before joining SCDD, she worked at schools in Maine and New York and worked on disability education policy at the federal level in Washington, D.C. She has received a Master of Public Policy from the American University and a Bachelor's in Political Science from SUNY. And we also have another presenter, Kira, and she is a fourth-year medical student who is interested in family medicine from the University of Rochester. And without further ado, the presenters can start talking whenever you guys are ready. Thank you.
Okay, this is Steve Sulkes. You can tell because I have the male voice. And thank you, by the way, Shannon, for the introduction. And as Shannon said, I have the good fortune to be the president of AADMD this year. I want to put in a plug before I get any further for our annual meeting, which is going to be happening in May here in Rochester. And we hope that everybody who's listening can find their way to get here. It is the prettiest time of year in Rochester. The snow is mostly melted, and we have our annual Lilac Festival going on, as well as all the good stuff that's going to be happening at the AADMD meeting. The topic for tonight is about advocacy, and many of you who have been involved in AADMD activities will know that advocacy is a big piece of the AADMD portfolio. We're all about helping people learn good clinical skills and coming up with evidence-based guidelines, but an ongoing piece that you always hear us talking about is our advocacy work. And now we have the good fortune to have an advocacy topic that can engage all of you and that we need your help in pushing. It is called the Heads Up Bill, and it relates to helping people with intellectual and developmental disabilities get designated at the federal level as medically underserved. Kira, are you on? Okay, Kira, I think, is not yet on. So what we should do is, I'm going to begin with her slides, Shannon, and just talk a little bit about Kira's activity. And, oops, Kira, are you there?
Hello?
Oh, Kira, you're on, right?
Hi.
Hey.
Hi, I've been having some trouble connecting, but I think
okay.
I'm
So
connected
so you can use your screen, or you can use or we have the screen there with the slide with your slides on it. So if
I'm
you're
happy
there,
to use your screen.
okay. So Shannon will advance the slides when you tell her to, and you can go to, and there it is. Okay.
Great.
I'm going to mute myself now. Goodbye for a while.
Okay. So I'm sorry I missed the beginning. My name's Kira Hayes. I'm a fourth-year medical student at the University of Rochester in Rochester, New York. And I've been talking to Dr. Sulkes about doing some advocacy work, and he told me about the new bill, the Heads Up bill, which had been submitted to the House over the summer. And this is something that's been kind of around for a while as an idea, but hadn't really gotten submitted. And so it's been very exciting to start working on this and prepare some information that we are going to share with you today on why this bill is important and ways that you can be involved in advocating for it in your home communities and nationally. So I just want to start by talking about the bill a little bit itself. So I see we're already on the right slide. So the Heads Up Act is a very long name. It stands for the Healthcare Extension and Accessibility for Developmentally Disabled and Underserved Population Act of 2018. And so in the Public Health Service Act, which is a 1944 policy, there's a designation for medically underserved communities. And the reason that this designation exists is because there are certain communities that aren't defined by geography that are medically underserved. So one of the examples, and I'll just draw from my own experience here, is the homeless community. And so obviously homeless communities are not specifically in certain geographic areas. Certainly there are areas where they're more common. But in order to increase access to healthcare services, homeless populations are given this special designation under the Public Health Act. And so it opens them up to a lot of opportunities to get healthcare services that they wouldn't necessarily be able to have otherwise. And that's because of lack of repayment for physicians that are working in those areas, and just not a whole lot of funding for healthcare in general. So a lot of the wording in the 1944 bill is, or the 1944 law, is related to how to increase and use funding specifically to help improve the healthcare access of these particular populations. So there's money that's given to do research on health disparities, quality of life, terminology, best practice guidelines, things like that. And then also money that supports residencies, loan forgiveness, training programs for different providers at like mid-level and physicians, etc. And financial incentives for curriculum development, things like the National Health Service Corps loan repayment types of things are all part of what is protected for medically underserved communities, and the types of things that are pertinent for this part of the bill. So like I said, one of the big things is that it designates funding, and you get HRSA support for these research, outreach, developing standards of practice, and getting more personnel into training and positions within that provide services for these medically underserved communities. So the Heads Up Act of 2018 was submitted in, I believe, July of this year. And what it does is it's a bipartisan bill that was introduced to the House, and then it was submitted to the House Committee on Energy and Commerce. And the submission was done by Seth Moulton of Massachusetts and has a number of co-sponsors: Greg Harper of Mississippi, Sean Maloney of New York, Brian Fitzpatrick of Pennsylvania, Andre Carson of Indiana, Jose Serrano of New York. And basically the bill is asking for an amendment to the 1944 Public Health Services Act. And we have all of this information in our toolkit that we'll make available at the end of the session today. And so it gives you a link to the bill itself if you want to go and read it. It's not super exciting reading. It basically just writes out which particular sentences in the 1944 law or act they would like to replace or add something to. And so what it does is it adds persons with intellectual and developmental disabilities as a medically underserved population, along with homeless, migrant, farm worker, and I'm not remembering off the top of my head the other members of that, of this special medically underserved population designation. So it would make
people who live in public housing. It's people who live in public housing is the third group.
Thank you. That's the third one.
Yep.
And so it would add people with intellectual or developmental disabilities to the list of special medically underserved populations. And so it would enable funding and service provision for people with intellectual and developmental disabilities to improve access to healthcare providers, improve education for healthcare providers, to really improve the health status of these populations. And this has been really important for me as a medical student, because I feel like my school has done a pretty good job of introducing us to some of the issues. And sorry, you can go to the next page on the PowerPoint. I think my school has done a pretty good job of introducing us to some of the health issues faced by people with intellectual and developmental disabilities, and being involved in the AADMD has helped me learn about that as well. But I certainly don't feel like I have the skills that I would need to go out and serve this population well, and to help people attain the same standard of care and health that a lot of other populations that I'm seeing in clinic and in the hospital are able to achieve just with typical education of providers. And it really became much more apparent for me when I was on my geriatrics rotation, actually, and I was at an Article 16 clinic, and I was really amazed by the amount of knowledge and training that people had received to care for this population so well. And I think that it would behoove the health of these individuals to have more providers that are specifically trained to help address their needs. And not only that, but are looking into where the gaps are in their needs and making sure that they are getting the same standard of care that we want for all of our patients. So what I had been doing the last few weeks was putting together information so that other people could share stories with their House representatives, so that we can get more interest in this bill and try to get it passed this year, or soon. Maybe this year is optimistic. So we've put together a toolkit. And so, like I said before, it has a little bit of information about the bill itself, a little bit of information about where you can find the specific wording related to medically underserved populations in the 1944 Act. And then also, you can read about some more reasons to support the bill. So that's the autistic advocacy resource that's listed here. And what it does is it really goes through more of those reasons why politically and kind of more of the big picture national issues, why health for this population is important, and and the healthcare needs are underserved currently. So it's a really great thing to read. It doesn't take that long. It can get dense at points, but a good skim through it is a helpful way to educate yourself more about what this bill would do for this population. We additionally put in there the bill tracker. So the AAFP, the American Academy of Family Practitioners, has a bill tracker, so you can look at federal bills and see where they're at. Like I said, currently the bill is in the House Committee on Energy and Commerce. So we also have a link so that you can contact your representative. So it'll give you an opportunity to put in your zip code, and then you would be able to put in the information about, you would be able to put in your zip code, and then it'll tell you who your House representative is. And also you can see if that person is on the Committee on Energy and Commerce, which is what this list is. And I know this is an overwhelming list of names, but I just wanted to put them on here in case and they're alphabetical by state, so you can see if someone from your state is on the committee. Now, this is the committee that has to pass the bill first before it comes back to the House, and I think Dr. Sulkes will talk about that more later. But so just, so that you have a knowledge of where the bill is right now, we obviously want to focus on the representatives that are a part of the Committee on Energy and Commerce first, as, like I said, they need to pass it first. So if you go to the next slide. Yeah, thank you. So I kind of shared with you background and my story on why this is important to me, but one of the toolkit has 4 pages. The first page talks to you about how to contact representatives, how to read about the bill. The second page focuses on how to learn more about the bill itself, and just does an overview of the bill so that you don't have to go and read it if you don't want to. And then the next 2 pages are about making your message, presenting your message, and talking to legislators. So I just want to review a little bit of what I put into that toolkit, and then we're going to talk about that more with people who have done more legislative work than I have. So I gave you a little bit of my story, but the main things to keep in mind are if your representative is someone who was involved in putting this bill in the first place, you always want to stay positive and appreciate what people have done in the past. And so if in your story you can incorporate things like, I really appreciate what you've done so far for individuals with intellectual and developmental disability. Thank you so much for being a supporter of this bill. That would be a really great thing to put into your message. But the main thing that we want people to think about is, why is this important to you and your patients, and how does it affect the work that you do in your practice? And if you can incorporate a personal story that's about your personal interactions with patients as opposed to diagnoses, that is wonderful. And we've put together a phone script as well as a letter that you can use, and you can edit as much as you choose, that has that kind of information in there. So there's like a line where you can put in your personal story if you choose to. And so that's a part of what we have available. And then there's also just, when you're preparing your message, really try to think about what has been the most impactful and important thing to you personally, and how that can give examples to your legislator of why this would be important and how it would allow you to better serve your patients. And I think some of the stuff that I read about was, if you can possibly say, I have patient catchment area of this many people, and show that you have the potential to impact others in your community and be a voice for, supporting this bill and have more of an impact with other people. Sorry, my cat is right next to me, if you can hear her. That would be a good thing to add as well. But the main thing is to keep it simple, make it about people, try to keep it short, like thinking about Twitter messages or things that are really easy for people to repeat and share and show personal impact in a personal story. So there's a little bit more information there for the message as a whole, but if you can go to the next slide, I kind of have like a top 10 points. Yeah, so there's online, there's a American Academy of Family Practitioners Congress 101 webinar that says that 80% of congressional offices say less than 30 posts will demand attention. So we have a little bit in there about how to work on Twitter, how to use Facebook, make sure you hashtag your district in there. And if you put your representative's Twitter or Facebook handle, make sure you use .at so that it stays connected to the post. And we made a handle as well, a hashtag for you to use, hashtag Heads Up Congress if you're posting about this on social media. Certainly social media is a great place to spread the word and get more people on your team. And one of the most important things, you'll see it as number 10, but it's very important, is to engage your allies and find out who it is that's going to be supportive of this in your home community. So I just put in top 10 things. This is just kind of a summary of what we put in the toolkit. Practice your message so that you really have it down, so that you can do it in 1 to 5 minutes, depending on how much time you really are going to have with your legislator. Be clear, be concise, make it repeatable and memorable, and especially make it personal. Connect with your professional communities, connect the bill to the issues that you're facing in your personal practice, and try to do your research on your representative as well and see if you can connect it to their interests or their past work. Always make sure you end with an ask. Ask for their support when this bill comes to their attention. Ask them to vote yes on the Heads Up Act, and be really flexible. You don't know where you're going to meet people. You don't know how much interest they're going to have, and make sure that you follow up with them regularly. And so if you go to the next slide, like I said, we put together a script as well as a phone script, a letter, and then this is a postcard that we'll have. So this is the front side of the postcard. If you're editing this or doing something else, always make sure you identify the name of the bill that you want people to pay attention to. And if you go to the next slide, this is kind of just a format that I used for the postcard as well as the letter as well as the phone script. You do not have to keep any of this. This is really just to help you have something that you can easily draw from, so that we all are very busy, and I think if there's more tools at our fingertips, we're all going to be more willing to be involved in advocacy. So feel free to edit this as much as possible. There's an opportunity for you to put in a sentence or two about your personal experiences. And then, up top, it's just as a parent, as a provider, as a medical student, make sure that you identify who you are and that you're a constituent of the representative. So that is all I have. And I think we're going to go on. We'll come back to questions later, and we will make the toolkit as well as the letter and the phone script available afterwards to download.
Actually, Kira, I am going to stop for questions for a minute.
Oh, okay.
Because, and I want to make one or two clarifying points.
Okay.
As you're going to hear in the rest of our session, you do not have to go to Washington to talk to your representatives, and they often are really they often have a local office that you can go into, and you're going to talk to their staff anyway. So you're not going to get it. You're probably not going to get a chance to talk to the representative in person. So it's perfectly fine to go to save your travel miles and go to the local office of your representative, because the message will still get there. So that was a point I wanted to make, because just so that people weren't intimidated that they had to all travel to Washington. Second point I wanted to make is that although this bill began in the House, we are also seeking Senate sponsors for it. And everybody on the call has 2 senators if you're in the United States. And so your senators, whichever party they're in, could become the Senate side sponsor for the same bill, because for it to become a law, it's going to have to pass both houses of Congress. So, for example, we're going to be going to talk to Senator Kirsten Gillibrand, who's one of the senators from New York State, and we think she actually will be interested in this. We've already talked to Senator Schumer's folks, and they're interested, but they just aren't interested in taking a leadership role in it right now. Now, having made a couple of those clarifying points, what I have a request to everybody on the call. Could you please use the messaging tool, which is is it the little question mark in the top of the top right of your screen, and just tell us what state you're in. We'd like to know where our audience is tonight, because this is a national issue. This is not just a New York State issue, although the three of us speaking happen to all be in New York. So everybody just take a second and use that messaging tool to tell us where you are. I'm now going to turn it back over to Kate Richardson, who's going to talk a little bit more about how to make a plan for that Hill visit or that legislative visit that you're going to make. Kate, you ready?
I am. Can you hear me?
Loud and clear. Yep.
Okay, great. So hi, everyone. I am the non-medical person on the webinar today. Shannon did an introduction before. I work for the medical center, but most of my work surrounds education and policy. But I do a bit of work with Steve and the LEND fellows at the medical center in Rochester. So he asked me to jump on tonight and talk about policy and advocacy and kind of what your role in the entire process is. We heard about a specific piece of legislation that we're really hoping you get engaged and active about, but I'm going to take a couple steps back and just talk about how you can engage in general. And, understanding that you're medical students right now, but you're going to, be providers, for a long career. So what is your role as an advocate in the policy process, and what are some of the rules around it? We were supposed to have Lori Chiamento, who is the Director of Federal Relations for the University of Rochester, but she is pregnant with twins, so she couldn't be here with us tonight. So I'm going to fill in as best as I can, but if you have any questions, feel free to put them in the chat box and I'll slow down. I tend to type fast, or type fast and talk fast. So kind of for the next half hour, Steve and I are going to bounce back and forth and walk through kind of understanding the difference between lobbying and advocacy. Like I said, considering your role as a professional and an advocate. And then Kira mentioned this, we don't want to reinvent the wheel. There are a lot of resources already out there for you. So just pointing you to some of those and getting you connected to kind of what's already out there. So lobbying, well, I'll back up. All lobbying is advocacy, but not all advocacy is lobbying. So if you're advocating, you're teaching lawmakers, and advocacy, obviously the definition is broader than this, but if you're advocating in terms of policy, you're educating policymakers about issues or ideas. But if you're lobbying, you're talking about a specific piece of legislation. So when you go, to the Hill, to Capitol Hill, or you go to a meeting, and wherever you are in the country, and you're talking about a specific piece of legislation, that's lobbying. So if you were to do any activities around the heads up piece of legislation, that would be lobbying, if you're attempting to influence how they're voting. And so different universities have different policies about lobbying. So I just wanted to make everybody aware of that. Our university, just wants to be made aware of the activities that we're doing so that they can record it, because a lot of universities, we're accepting federal funds. So this is a federal piece of legislation that we're talking about. So they just want to monitor it, because if you're accepting federal funds, but you're at the same time trying to influence federal policy, you can see how kind of ethically that gets a little messy. So just this is more of a plug to be mindful of the state you're in and what the policies at the state level say, what the, if you're at a university, what the university policies are. In every position, you're able to advocate, you're able to talk about issues, educate policymakers, but when you get into the direct lobbying, you have to be a little bit more careful sometimes. So some universities that I'm aware of don't want you doing it from a university email. So, I'd have to send emails from my Gmail account if I want to talk about a specific piece of legislation. I'm completely federally funded, so I do have to be pretty careful. Some universities don't want you doing it while you're on the clock, so you have to do it off hours. So I would just encourage you to be aware that there is a distinction, and it's about the specific legislation piece. So next slide. Steve, do you have anything to add to that? Okay. So
no, actually I do. I'm sorry.
Okay.
I had to unmute myself. Okay. So go back one, Shannon. Back one slide, if we could. Thank you. You notice at the bottom it says email, phone, in-person meeting. We may get to this a little bit later in the discussion, but ways of reaching out to legislators are the ones that are on that slide. The text of the postcard that Kara shared with us is spectacularly good text. But if you send a postcard to Capitol Hill, it goes into a warehouse to be checked for anthrax. And it takes a long time till it ever gets to your legislator. So every legislator has a website, and you can upload a message to that legislator on their website, and it's secure email that you don't even have to use your office email for. It's a very good way to do it because it's their website. They actually look at what comes into them. So I just wanted people to know that that's a specific, a little bit off the topic of what's lobbying versus advocacy. But anyway, carry on. I'm sorry.
That's great. And I feel like, so I start off as this like very intense, be careful about lobbying, but we're here today because we want you to advocate and be involved in the process. So the rest of the presentation is going to be really encouraging you to get involved, and kind of what Kira was talking about was at the federal level, but at the state level and at the local level as well. So we know that there's some roadblocks to advocacy, and this isn't just, in the medical sphere, but kind of in general. Why aren't citizens engaged in the advocacy process? And it's because they're not comfortable with the process. They might not know, where to start or where to get help or feel like they know enough to advocate. But we're here today to kind of break down some of those barriers and share information with you so you do feel empowered to advocate. This is some of our LEN fellows who were in DC, but like Steve said, you don't need to go to DC to do this. You don't need to know everything about every piece of legislation. Like Kira said, the laws are often pretty boring, so you don't need to have read the whole bill to have a conversation. So we're going to kind of break it down over the next couple of minutes about some things that will make you feel more comfortable to get engaged. So I'm a super type A, so using those roadblocks as a structure is how I kind of organize the presentation. So, the first one, not feeling comfortable with the advocacy process. This is kind of like 8th grade US history, and it seems silly to go over it, but I think, knowing that, policy is government policy affecting public interest, and you need a law to establish public policy is important to know, but it's critically important to know that policies can be changed. And so because, the bill is written one way doesn't mean that it needs to be that way forever. And policy is a cycle. It's a process. We're talking about a process. So policies, should be updated if they're not working for the community. And so your job as providers is to give feedback to legislators at different levels of government. So, when you're thinking about different policies, think about what level of government that policy was passed to influence. So the one we talked about when we started this presentation was a federal level policy. So you're going to want to engage with federal level legislators when you're talking about the policy. But if it was something at the state level, you would want to go to your state senators or assemblymen. So there's a lot of different people engaged in the process, but just know that policies can be updated and changed. So This isn't going to be like I'm going to engage in the heads up legislation and then be done. There's a lot of policies out there, and that are ever changing. And I would encourage you throughout your career to continue to be engaged in the policy process. So we talked about the different levels of government being federal, state, and local. And like Steve said, we're all from New York here, so I included some New York related statistics, but this is true for every state and every community across the country. And there are different branches of government. Again, I know this is like social studies 8th grade 101, but it's the legislative branch that makes the laws. So you're gonna, when you go to DC, if you go to DC, you're going to Capitol Hill and you're talking to Congress members. Sometimes different federal agencies will implement rules that can impact patients or other people that you serve. So you might go to the Department of Health and Human Services. So just know if you are actively setting up meetings yourselves, that there's, depending on what the bill or what the rule or what the law is, there's different people that you're going to want to go to. And then all of that said, Lori, again, is not on the call tonight. But typically, if you're at a university, there's going to be somebody in that university that can help you navigate all of that, so you're not doing it alone. So, if I have something that I'm wanting to be active on, I connect with Lori and I say, can you help me make a meeting? We have a state person too. We have a local person too. So there is a lot of information to know, but typically universities especially are pretty well resourced. So if you've decided that you want to be active, being mindful about a strategy is a good next step. So, what is the issue that you're wanting to impact? What does the data say around it? And in your position, you are privy to a lot of data, a lot of medical record data and that type of stuff. So, and Kira was saying, legislators love to hear about the number of people a policy change is going to impact. So the more data that you have, to justify the need for a policy change, the better off you're going to be. Cost, we were talking about a 1944 bill that we're still trying to change, but cost is something that we think about every year. We're talking about the federal level here, so the government's shut down right now because of a funding bill that wasn't passed. So that happens every year. So cost is a really big deal. So the more you can talk about numbers and bring that into justifying your request, the better off you're going to be. Steve, anything with that? Kind of the roadblock was lack of comfort with the advocacy process. I think, knowledge is power. Knowing about the advocacy process in general, I think people, once they have a better understanding of the process, feel more comfortable being active in it.
Can I add something there?
Absolutely.
Okay, in terms of comfort?
Yeah.
Okay, so staffers who work for people in Congress, whether they're representatives or senators, are people who are young. They are people in their 20s, okay, maybe 30s. Probably, I don't know exactly who's on the webinar tonight, but they're young, and they have huge lists of things they have to focus on. The thing you know about you are such an expert on compared to them that you can actually help yourself become comfortable by just going in and talking about what you know. They love to get information about stuff when they're interested in the topic, and I having been a clinical physician all my career and being very intimidated by going to the Hill, the first time I went was to talk to one of the legislative aides for Senator Hillary Clinton when she was in the Senate. And it was to talk about autism. Well, heck, I knew about autism. I saw autism all the time. This was my opportunity to educate this staffer about autism without even asking for a particular bit of legislation. It was just to share information that this person could use as by way of learning. So I'm saying that because when you feel because it's very intimidating to going in and feeling like you have to be asking for something. On the other hand, you can go in and outline a problem that they may not even know exists, and then bingo bango, give them the solution to the problem. I'll make one other point that I always make when I'm talking about this, and then I'll give it back to Kate, which is that I like to put everything in terms of Broadway musicals when possible. And my very favorite musical of all is the one, The Music Man. And in that, this salesman is trying to sell bands. And what he does is he identifies a problem in the town. It has nothing to do with music, but by the end of Act 1, he's convinced everybody in town that the way to fix this problem is by having a band, and everybody buys instruments. So if you can identify a problem and share it with the person and then give them the solution, you've got them halfway where you want them. Kate, take it away.
Okay, I couldn't agree more. So kind of building off of that, so let's say that you now feel comfortable and you're wanting to engage, but you're not sure where to start. I would encourage you to figure out who your government leaders are. I think I don't know what channel it was on, but they were interviewing people in Times Square asking who their, senators were, and nobody knew. So just knowing who your government leaders are at different levels and just being aware of who you would talk to is a fantastic first step. So like Steve said, we've been working, for years trying to get this, some version of the Heads Up bill passed, and we've been to Chuck Schumer's office, we've been to Gillibrand's office, but it took us knowing that Chuck and Kirsten were the right people to go to. So, Google is a powerful tool. So figuring out at the different levels of government who is the right person to talk to, and then connecting. We've said this over and over. You can connect by email, writing a letter, send the postcard. You can call, you can set up a meeting, or do both. I think hitting people from multiple points is your best shot. Like Steve said, you could send a postcard and it could get lost in the dungeon of Capitol Hill for weeks. So maybe doing both is a good strategy. And it's just introducing yourself, saying that you're a resource, that you're there to share your expertise, and you're also there to help them. And so typically when you're talking about engaging in the policy process, you're not wanting it to be a one-off conversation. You're wanting to develop relationships. So they know that Steve is an expert related to autism at this point. And so if they have a bill that comes across their desk, they're going to call Steve. And he honestly has that relationship with people. So, starting young in your career and developing relationships with different levels of government is critically important, and you have the ability, especially in your roles, to make significant change. And like Steve said, every member of government typically has their own website. So you just Google their name and it will pop up, and you can learn about them. You can learn about the issues that they care about. I think it's Pennsylvania Senator Casey is really, really engaged in disability issues. So knowing what issues your different members of Congress and at the state, federal level are engaged in is important, and you can find that on their website. And in that contact button at the bottom is where this email Chuck pops up, and that, you select an option that you care about so it directs to the right staff in their office, and a lot of times there's the text like what Kira shared with you that you can just copy, paste, and drop in. And Twitter, Kira mentioned engaging on Twitter is a fantastic way to engage with members of Congress. They all have Twitter handles. You can kind of follow along with what they care about and what what bills are up. When we were talking about why we're doing this Grand Rounds presentation right now, it's because we just, I think it's today, started a new Congress. So the 116th Congress was all sworn in. So it's the start of a new session. So it's a really good time to engage in, at the federal level. So now you know where to go, but you're not sure where to get help. you know, we all have really strong networks in our professional lives that we totally want to take advantage of. That's a picture of our dear friend Steve up in the left corner. You know, if it's especially a medically related issue, I'm not a medical person, so I'm going to him. If, you know, if I'm at a meeting and they ask me a question and I don't know the answer, I'll say, I'm not sure, but my office is across from Dr. Sulkes, and I'm going to ask him, and we're going to get you an answer. And that's true of a lot of different people. I have self-advocates that I go to. If I want to know how a policy is impacting a person, you would go to a patient and talk to them. Carrie's a mom in the bottom. You know, she's a mom of a daughter with Down syndrome. If I have a question about kind of how families are experiencing the medical system, for example, I would talk to Carrie. My cousin Leanne is an attorney, so if I'm, you know, not understanding how a piece of legislation, you know, might be interpreted, I'd ask her. My dad is an economist. You know, if I'm wondering about how to justify this cost, I might run the numbers by him. So just because you're medical people, I would encourage you to expand your network, you know, make connections to families, you know, think about the different people in your lives and how they might be able to help you as you engage in the advocacy process. So, you know, if you're a New Yorker and you're wanting to go to Albany to talk about a certain, you know, bill or something, think about your network before you go and kind of create a bunch of resources that can help you think through the issue that you're going to talk about. And then, you know, outside of your personal network, there are coalitions, associations. We're here today as a part of an association and different allies in your community. So, you know, a message is a lot stronger if it's coming from a number of different people. The Consortium for Citizens with Disabilities is absolutely fantastic. They're based in Washington, D.C., and they have, they do healthcare work, they do education work. So oftentimes you can get position statements and text about different things from these different associations that you can just spit out and, you know, share a personal story about. So I would just encourage you to stay connected and continue to engage in the policy process through those coalitions. So the last one, not feeling like you're an expert enough to advocate, you know, this one is going to be different for different professions. I think in the medical sphere, you're definitely expert enough to advocate. You know, if you're early in your career and you're feeling like you don't have enough experience under your belt, that's not true. You know, if you're new to a new place and you feel like you don't know the community enough, that's not true. I think, you know, if you do your research and come with data, they really are wanting to hear from you and wanting to engage with you in the process. So I think I can't say enough that your experience is important. Having our legislators hear from multiple perspectives is really important. So I would just encourage you to continue to engage and share your stories. One more resource I wanted to share, the AUCD, the Association of University Centers on Disabilities, does a policy brief. I think it comes out every week. So if you go on and sign up for that, they only do federal, well, sometimes they do state stuff, but they do mostly federal level stuff. And they break it down by issue area. So they have a health section that will talk about the bills that are kind of up for reauthorization or have some movement or traction. So it gets overwhelming to try to track all of the different bills that are moving. I think Kira mentioned a bill tracker that AAFP might have. So there are different resources that do that tracking for you. So you might not have an opinion on every single healthcare bill that comes up, but if you see something that you think you could add value to, I would encourage you to engage in that process. So that's kind of the chunk, the background, the story to it. So I hope we've convinced you that your opinions are valuable, and we really encourage you to advocate. And so just for the last 10 minutes, I wanted to get into the nuts and bolts of how to structure a meeting, how to make the call, that type of stuff. And Kira did a lot of that, and I know that's in your toolkit too. So this is kind of repetition here. but this could be true of a phone call. We've said that it's the structure of a meeting or an elevator speech, but you could put this together for a phone call. So let's say, you're from, Maine, and you go to Bangor or with Augusta. I'm really testing myself here. You go to Augusta and you're meeting with your, the staff or one of the senators, and you sit down and you say who you are and where you come from, and that you're really worried about this issue, and you give some data to back it up, and then you tell a story about a patient to kind of make it real, because I think a lot of times, they talk about the bureaucracy of Washington. You get disconnected from the real story. So the more that you can bring in personal stories and make it real, the better off you're going to be. So that's true of any issue. And like Kira said, you wrap it up, you give a final ask, and then you say thank you. And then if you're at a meeting, you follow it up with an email, so they're hearing from you again. You might I've gotten a half hour before of people's time, but I've also gotten 5 minutes in a hallway. So, like Steve said, we're not expecting you all to charge Washington and go down to Washington every year. But if that's something that happens for you in your career, and you go there and you have 10 meetings set up, 2 of them might happen in a hallway, 1 of them might happen in a closet. That stuff just is happening at such a rapid pace down there that you just need to be kind of flexible and prepared for anything. So some tips that, we've said a lot of these things before, but talking about what's important to you is going to make the meeting more meaningful. Sharing a story. If you're going in person, dressing professionally is really important. I didn't get into kind of the geography of Capitol Hill, but it's a 10-minute walk from the Senate side to the House side. So wearing comfy shoes. I made a rookie mistake once and was walking barefoot because I had blisters everywhere. So wearing comfy shoes is critically important if you're in Washington, but I would imagine that's true anywhere. Giving yourself plenty of time. You have to go through security, not bringing crazy things in your bags, having kind of a list of where you're going. And like I said, if you're working for a university, the federal relations folks might set up a schedule for you and tell you where you're going, but having a plan always makes things go smoother if you're setting up multiple meetings for yourself. So for example, Steve and I and a couple other folks are going to be talking about the heads up legislation with New Yorkers, and we're trying to set our meetings up for one day. So, having a plan and sticking to that plan and giving yourself enough time, a half hour in between meetings, because you're not sure if they're going to be 5 minutes or 30 minutes, makes a lot of sense. I like to bring supporting materials. So I typically bring a folder with everything that I'm talking about to leave them in text as well. And then I follow it up with an email, because you could be hitting multiple people. They could tell you that, you're going to meet with their health staffer, but you could end up meeting with like the scheduler or intern. So the more materials you could flood their office with, the better off you're going to be. So I know we gave you an example with the heads up legislation, which is really specific, but Medicaid funding, this was the last slide that I have for you is a sample from a dental student we worked with a couple years ago that I thought was a really cool one for you guys to hear, because it's relevant always. The issue is, the constant pressure to cut or curb Medicaid spending. So this was a dental student at the University of Rochester who was working in our complex care center. And so she came to Washington with us, and she kind of spelled out, the issue. It was at a time where I think they were trying to repeal the ACA and talking about capping or block granting Medicaid. So, she was advocating, kind of for Medicaid in general, and explaining that Medicaid covers preventative dental care every 6 months, and the cost of that visit is $160. So there's the data. She told a story about a patient with IDD, cerebral palsy, had seizures, and had not seen a dentist in 15 years. His group home was 2.5 hours away from the complex care center, who was able to see patients in wheelchairs. So when that complex care center was built, he came in with dental pain and a swollen face, and the dentist, she found multiple non-restorable teeth. They ultimately ended up extracting 13 teeth, leaving only 4 remaining teeth, which cost Medicaid $7,000. And quality of life is impacted. So you can see the cost differential there with preventative care, but you're breaking it down. And you're asking Congress kind of just to understand the reality of Medicaid and the necessity it has for people with IDD and their families in general. So I thought that was a really cool story. That it's simple to understand. So if you're sitting there and explaining it, it's simple to understand that the cost savings is significant. So I'm sure you're going to see a lot of cases like this where you can talk about Medicaid or other issues and really make a difference. So that's all I have. Steve, do you have anything to add now that I've babbled for a half hour?
Sure. A few more things, and I really want to open it up for questions. But I don't know that we've said this, but this is fun. It actually is great fun to go have these conversations with people. And I actually, I guess it's Courtney running the slides now. Could you back up a few until you get to the one with Abra in it? I just want to add one more story. There it is, right there. Perfect. So on the right, you see Abra Karochi, who is the education chair for AADMD. Dr. Karochi is a pediatric dentist here in Rochester, and this is on one of our visits to DC. The visit that I was with him on with this group took place in a storage closet, and the woman in the wheelchair on the left had to negotiate the chair into the closet, which made all kinds of good conversation about physical accessibility. But Abra, in talking about this legislation, before it was legislation, talked about his commitment to serving people with developmental disabilities, and then said, and now I'm about to go into practice, and I'm going to go into pediatric dental practice, and I can't afford to serve only people with developmental disabilities because I have $500,000 worth of loans or some such number. The point is that the loan forgiveness that would come with this bill was very specific, and it was very meaningful. And the staffer who heard that said, "Wow!" But you would serve this population all the time if you could get your loans forgiven. And he said, "Absolutely." He said, "But I can't afford to do that for several years because I have to have my practice only serve a few people with developmental disabilities." So it sounds like it's kind of a self-serving thing, but it's not at all, and it's a very powerful story. So anyway, I just wanted to share that story about Abra, who many of you know, and open it up for questions.
Thank you so much for presenting. I learned a lot. That was very helpful. One of the questions was, will the PowerPoint be available after the presentation? Would you guys, I usually send an email.
Yes, absolutely, yes.
Okay, then I will send the PowerPoint in the email to everyone. Would you like me to go through the states or just?
Oh, sure, yeah.
Connecticut, Wisconsin, Washington State, Texas, Pennsylvania, California, Canada, Florida.
Excuse me, Canada is not a state in the United States, for those who were confused. Okay, keep going. No. I'm sorry, we thought of annexing it, but it hasn't worked out yet. Okay, keep going.
Colorado,
yeah.
New York, New Mexico, and that's it. And then we have another question. Could you provide assistance in California to get in touch with our senators?
Could we give you assistance in California?
I think that it's CA. I'm not sure.
Yeah, that's right. That's right.
Okay.
So actually, so here's what I would do if I were you. Okay, and I don't know who you are, and I don't know where in California you are.
It's Alicia. That's what I have.
Oh, Alicia. Okay, so so the easy thing to do is to go to the senator's website and find out where those senators have local offices. Okay, and you find the local office closest to you, and you actually pick, and they'll have a phone number, and you pick up the phone and you call them, or you send them an email. They'll have contact information for that office, and you can actually make an appointment to walk in and make your pitch to Senator Feinstein's office or to Senator Harris's office, and both of them would be very friendly to this kind of legislation.
And
I remember the two California senators. I win. Okay.
I know. I'm very proud. The other thing I would say for the California, for Alicia, is if you, I'm not sure if you're connected with AUCD, but there's 3 UCEDs in California. There's one at the Tarjan Center at UCLA, USC, and then UC Davis, and they're definitely connected to the senators. So if you can definitely send your senators a direct email, but if you connect with these folks at those universities, I'm not sure if you're connected to one of those universities or, but they definitely have relationships, so that might be a way to get in. And they're thinking about disability issues, and I'm sure they would love to have an ally. So again, my point about using different networks and associations, I think getting to senators through the UCED. So every state has a UCED. I'm not sure how familiar you all are with the UCED network, but each state has at least one UCED, and AUCD.org has a map. So you can get on there and see the UCED and the LENS and the IDDRCs that are that exist in your state. So in New York, we have 3. We have one in Rochester, one in Westchester, and one in the Bronx. And again, like I said, California has 3. So if you're not getting anywhere, sometimes we have an easier time connecting with Schumer's office than we do Gillibrand's, and that's just the way
so
our relationship has worked in the past.
Yeah. Okay. And Courtney just asked a good question, and that's and AADMD has members and leaders all over the country as well. If you are a member of AADMD, a student member through your chapter, or a bless your heart dues paying member, you can go to the AADMD website and search for a member in your state, in your area. Alicia Bazzano is in Los Angeles. She's one of our board members. She would be a great partner in this. She is super committed to this topic and would love to go with you on a visit. So thank you, Courtney, for that suggestion. That was great.
Can I add something as well?
I'm sorry?
Sure. Can I add something as well? It's to that of who can help with these conversations and visits.
I'm sorry, I didn't understand that.
Very well.
Oh, can you hear me now?
Much better, thank you. Yes.
Okay. Yeah, I don't know what that was. So I just wanted to add that as far as I know right now, and you can correct me if I'm incorrect about this, but the American Academy of Pediatrics, Public Health, and AMA have all supported this bill or variations of this bill. So
yes.
Other student organizations that are involved in those kinds of things, or people that work with this population, if you, like me, sometimes get nervous about going and doing something big like this by yourself, there are probably lots of other people, other student organizations that have members who would be interested in advocacy and or lobbying, and may have more of those connections already in place depending on what their groups have done in the past. So for example, I know at University of Rochester, our American Medical Association student group is pretty involved at the national level in these kinds of conversations and regularly goes to Washington, D.C. So there might be other people who know more or, just have more experience that you can partner with in that way.
Okay, and then I think this may have been already answered, but is the organization going to reach out to the state senators for developmental and disability to include their medical student, residents, and self-advocates in this project? Not really sure exactly what that meant. I think they're asking if, like, in your guys' project, are there medical students and self-advocates in this?
Yes. Yeah, this is, we have, yeah.
I don't know if whoever asked that question, like, maybe I'm not reading this correctly, but if you guys want to send another one, yeah, it's kind of confusing. Sorry. Okay, well, nobody's claiming for it, so, all right. That was our last question, so thank you guys, and I'll send out, if you want me to send out your guys' emails and contact information if anybody else wants to get in contact with you.
We would welcome it, yeah.
Okay, and the PowerPoint. And so that's it, I think. Thank you so much.
Thank you all for joining us tonight.
Thank you. Have a good night.
Thanks, Kira. Thanks, Kate.
Yeah, thank you.
Thank you.
Bye, everybody.
Bye.
Bye.